Welcome, everybody. Glad you're here today. We do have one special guest here today. Dave Ryan's here with us, who is the executive director of the Anschutz Foundation. And as I think all of you know, they are our lead donor, and without whom this campus would not look like it does today. So Dave, welcome. You know, for those of you that have been to this event before, you'll note that this is somewhat of a different format. And I think as we thought about the state of the campus, it required a conversation, or it lent itself to a conversation that's different than those that we've had in the past. In many ways, the hardest thing to deal with, I think, for any institution in thinking of its future is uncertainty. And there is no question that at some level at the state, and certainly at the federal level, we face some very uncertain times. And we thought that reality was a good reason to have the four people that you see up on the stage talk about that subject and how it really impacts the way we look at our years ahead. And that's really the purpose of this afternoon. So thank you for joining us. I'm told we have something north of 1,000 people on the Zoom link already. So apparently the subject has some meaning to folks. We also have Tom Grano here, who's the CEO of University Hospital. Tom, welcome. And of course, thanks to our panelists. To my left, Jena Hausmann, the CEO of Children's Hospital. Beyond her, Liz Concordia, the CEO of UCHealth, and John Sampson, who's the Dean of the School of Medicine and is also speaking in his role as Vice Chancellor for Health Affairs. So I'm thrilled that they were joining it. As I said, these are kind of extraordinary times, and that's really why we thought this conversation made the most sense. I think that the thing that you're going to hear is that in spite of that uncertainty, we still have the same true north, and that's our missions. We're all playing from the same songbook, and we rise together, prosper together, and we face challenges together. And that's really what we're here to talk about today. We're going to start with a question for each of the three panelists here, and I'll start with Jena. Children's Hospital has made a pretty remarkable comeback after the kind of economic malaise of the pandemic, and now you found yourself most recently ranked very solidly in the top 5 among children's hospitals in North America, which is one hell of an achievement. Talk to us about given that, how do you think you keep that momentum going? I mean, what's your feeling on the challenges that you face and how you're going to rise to them?
Yeah, I think the beautiful thing about a mission like Children's Hospital is that 17,000 team members come every day just genuinely committed to do right by kids and families and the health of children, not just in those in our care, but when we think about our market presence in Colorado, we take care of about 70% of all of Colorado's children. And that is about right for where we are, because we partner with many of the other hospitals that are taking care of that other 30%. So for us, we are looking very significantly to regional and national growth, and many of our programs that are some of the top-rated programs in the country are the ones that are attracting an increasing number of patients from across the Rocky Mountain region and across the country. All 50 states now we serve for their children in many of our programs, and over 70 countries. And so we really are thinking about our impact on the health and well-being of children on that macro scale. And that creates, I think, for us, a number of innovative growth strategies. All of these, though, anchor around the people, the recruiting and retaining the absolute best talent we can in the pediatric subspecialties specialties that are making these programs world-class. And they are creating these multidisciplinary teams in this culture that is collaborative and very team-oriented. And I think so the momentum of our people, the momentum of our culture, the momentum of big visions and strategies to think about impacting child health on a national and international scale. The research investments are essential to that. You can't have the best programs in the country without having that synergy between the research investments with the clinical translation and the clinical outcomes. And so I think there's the momentum is positive. And I think that trajectory, we feel that energy and excitement, and that it all kind of anchors back to just our commitment to do this for the health and well-being of kids. The challenges are real, and you know what I think keeps me up at night.
What percentage of your patient base is on government funded?
50% of the patients we see are on Medicaid, and that is true for the country. So half of America's children are on Medicaid, divided across 50 different state Medicaid programs. And because we see them all, we know how different the benefit sets are, how different the payment rates are by all 50 state Medicaid programs. And to me, this is a travesty for the health and well-being of children in our country, that they have become a rounding error in state Medicaid budgets, but it's half of America's children, and it's half of the kids that we care for. So the role politics is playing in healthcare right now is an extreme challenge for all of us. And I don't just mean one party, one administration. I mean the inability for our elected leaders at a national level and a state level to be able to think holistically and comprehensively about the health and well-being of citizens in our country, and what that means not just for physical health, but the lack of parity in mental health services and the lack of ability to think about the whole human in how we design health systems. And when they just try to go fix a piece, the whole thing begins to unravel. And often it is the delivery system, hospitals, health systems, providers that are at the focal point of that energy or that scalpel. So I think the politics are real. That affects the reimbursement. And then the last thing I would say about challenge, I think, is really going to be the provider workforce. So we know that we have, in pediatrics specifically, already many residency and fellowship slots not filling at some of the top children's hospitals in the country and their affiliated medical schools. And the prediction for what's coming is quite alarming. And so we'll be spending a lot of energy thinking as a country in the children's hospitals and schools of medicine and departments of pediatric and surgery and anesthesia and all the departments that produce pediatric subspecialists. How do we think about a very different model for pediatric providers?
Liz, the same general question applies to you. I think, under your leadership, UCHealth has had really an extraordinary run of success, not just at University Hospital, but across the system. But those same clouds that Jena just talked about are staring you in the face. And so if you would, talk to us about how you think about your strategies moving forward and what you think, how are you going to balance the potential threats with strategies that emphasize growth?
Sure. I think, as you said, uncertainty is a challenge. And to add on to the challenges that Jena mentioned, I think when you look at what's happening in the environment, Colorado is the 6th most regulated state. And so when you look at trying to run a health system, we're 14 hospitals now, it's not just focused on specifically what's happening in our healthcare world, but what's happening across the country and across the state. So Medicaid funding is a huge issue for us. We are the largest Medicaid provider in Colorado, and we see the challenge from the federal funding perspective, reductions, and then we also see the state increasing their regulation year after year, the hundreds of bills that have passed that have increased the cost of care and compliance for Jena and myself and other systems to comply with the regulation. And 70% of all of the inpatient admissions across all of Colorado's hospitals are government pay. So when we look at the business unfriendly environment right now in Colorado, it's really concerning because, as you all know, government, Medicare, and Medicaid do not cover the cost of care. And if we are focused on wanting to improve the lives of the patients that live and the residents that live in Colorado, we've got to figure out an affordable way to be able, for those patients to be able to access our care, which means you can't have Medicare and Medicaid for 70% of your volume not covering the cost of care, and then you have to cost shift to your business community. So what we're very focused on is how do we make sure that we live our mission of improving lives while we're in an environment where more and more government pay is coming in. They're reducing the reimbursement for government pay, and yet the business environment in Colorado has become very unfriendly. So believe it or not, one of the things that I am focused on is trying to help our governor and others bring new business into Colorado, because we really do need new business here. And then from a very specific health system perspective, we are very focused on ensuring that our quality is phenomenal, that we focus on the patient experience, that we really look at innovation and how do we deliver not just the most innovative care from a clinical trials perspective, but also from a technology perspective, and make sure that patients have access to us. And so one of the things that we're very focused on is patients come to us and they want our care. And when I say our, it's School of Medicine, it's UCHealth Medical Group, and it's the amazing faculty that we have here, because we give them hope and they trust us. And so when we look at the positive and optimism, we have an amazing partnership with our clinicians. We have incredible quality outcomes. We're very proud of the experience that our patients have. We try to make it as easy for them to interact with us through our app and other components, while we still want to recognize that we've got challenges. We also want to send a message of stability, and there's a lot of positivity, and we are the place where patients do want to come. So I am sort of optimistic from that perspective, but we certainly do have challenges. And I think when you look at our growth over the last decade, one of the defining characteristics, I think, of the organization has been our ability to adapt and evolve and to change. And we know with what's happening and the uncertainty, one thing we know for sure is we are going to have to change. We're going to have to figure out new innovative models, like Jena mentioned, because of the change in the faculty and training individuals wanting to go into various specialties, nursing care models and the like. So we know that the culture of evolving, adapting, and changing is one of our strengths. And the clinicians that do that with us every day, we think differentiates us and gives us, we think, a very positive position moving forward.
Thanks. John, you've been here a little over a year. You came in on this mantra of we want to be top 10 in 10. Given the environment that we're facing right now, I guess the first question is, do you think that's realistic with the headwinds that appear to be upon us? And what's it going to take to get there? And if you could also speak to the fact, as Vice Chancellor, of how the other schools play in that same sense of accomplishment.
Well, in answer to your first question, hell yeah. With this team,
I never doubted that was going to be the case.
with this team, I have no doubt we're going to be able to do that. What I will acknowledge, though, is particularly in the current environment, there is anxiety, there's disappointment, and there may even be fear. Those will be some of the challenges that we will have to overcome in that context. But even in that context, there's an incredible number of positive signals, right? On the clinical side, our productivity is up 6%, our collections are up even more, and we still provide the most complex, highest quality care in the entire state. From the research perspective, at least the NIH budget's flat. But for us, there's been a tremendous uptick. Our uptick in grants at the NIH and overall in the first part of this year is up 40% compared to last year. Now, I'll acknowledge that some of that is probably a delay in some of the funds coming in, and some of that is funds that, more recent applications and so on, but it's still a dramatic increase. The applications are also up 10%. And from an educational perspective, we're working with our partners on new models for UME and GME funding, and our new and novel curriculum is getting rave reviews. I also feel that we're involved more in the community than we've ever been. What will it take?
It's going to take some kindness. We have to acknowledge when each other need a little help. And it's going to take cooperation. I don't think the school can achieve this by itself. It needs the partners of the Chancellor's office and our hospital partners, both the ones here today, but also Denver Health, National Jewish, the VA, other places that we work with. And we need to keep the other schools and colleges in our system strong. I think one of the things that attracted me here was the incredible strength of those other schools. It turns out that top 10 schools of medicine almost always have a top 10 school of public health. So we need that. We need the diversity of the opportunities with a School of Public Health in augmented intelligence, in areas of biostatistics to remain strong and to create those collaborative grants. We need a School of Nursing that's willing to partner with us and is partnering with us in areas of obstetrics and in anesthesia to enhance the way that we educate people to provide a different workforce. We need willingness from our partners in the graduate school to modernize education, to help reduce student debt and provide more science in a new way going forward. Our dental school does amazing things by allowing us to provide top-notch oral maxillofacial care in our hospital systems that we could never do just with a pure approach from dentistry or from medicine alone. And our School of Pharmacy, well, our School of Pharmacy is already top 12, so they're pretty close, so that's helpful. But they also provide a whole different level of expertise that I think will allow us to achieve those partnerships which will drive us up. So for all those reasons, hell yeah.
I like hell yeah. So we asked for questions to be submitted by email prior, and we're going to do a few of those before we turn it over to questions from the Zoom and questions from people in the audience. And the first question, and I promise I didn't write it, even though you might presume that I did, is Children's Hospital Colorado and UCHealth are both large systems with multiple locations across the state. How do your hospitals and clinics help support the academic and research mission on the campus?
Right. Do you want me to go first, or do you want to go?
Sure. So I think I mentioned we have 14 hospitals. And when you look at our world-class programs like oncology, and we've said we want to have advanced care close to home, we provide clinical trials and advanced care outside of just this campus. And so when we look at partnership, it flows both ways. So with those hospitals, we also have a significantly large ambulatory footprint who see patients who then get transferred here for the most complex care that is needed. So when you look at the partnership, I think that the most important piece is that we send advanced care out, and we also make sure that when complex procedures need to be done, they can seamlessly be transferred here, and those patients have a consistent and reliable experience when they interact with us. And it's the faculty teaching and education also that then gets exposure and access to a large number of those complex cases.
Yeah, and at Children's, we grew up a little differently. So we have 4 hospitals. All of them have been birthed out of the hospital, our largest hospital here on the Anschutz Medical Campus. And so the model we have is although 4 different hospitals, they all live and breathe and interact as if they're one hospital under one brand, under one mission. And the physician model is more unique in our environment because the child health faculty at CU go with us. About 90% of the medical staff provider services are through the child health faculty at CU. And that's just how we grew up. And so with the intersection of our clinical mission, our research mission, education, and advocacy missions are just, they just hum in a very unified way and not different by campus or geographic location.
Okay, thank you. John, shifting somewhat the focus, but staying on the government issue, we depend hugely on federal funding, obviously.
Yeah.
And one very large piece of that is what's called Facilities and Administration, or F&A. Would you speak for a second on what your view is on where you think that discussion is headed and how we might see ourselves several months, if not a year, down the road?
Sure. I wish I had the answer to that.
Right.
If so, I would step off the stage and make some stock trades because I would do very well. I mean, I think that the initial sort of volley was a cut down to 15%, and I don't think that's going to happen. That would be really unsustainable for any academic medical center in the country, and I do believe that the people of this country value academic medical centers, and so I don't think we're going to get to that cut. Will we have some cut? Yeah, I expect we will. I think we are in a much better position to absorb that than many, if not almost all, other institutions. We have extraordinarily well-run hospital systems that, despite the headwinds, remain profitable through that extraordinary management. We are also fortunate to have a clinical practice that also has opportunities through our departments and through our margins to reinvest in our academic mission. So shortfalls on some of those things, I think we can make up through some of those funds and through some efficiencies. If we end up having F&A cuts, 10%, not down to 10%, but 10% or 15% from where they are now, we will need to tighten our belts a little bit. We'll need to become more efficient. I think there's room for that in the system, but I don't think that'll be catastrophic. And frankly, maybe this is just my odd perspective, but I think that cut will actually impact us less than others. And as a result, we will be able to use that as an opportunity to pull ahead of other institutions.
And that really speaks back to, I think, a comment that Liz made. Academic institutions are not generally known as nimble. That is not a characteristic that one would apply across the spectrum relative to other institutions in the country. And I think that the imperative for us, and it is an imperative, is that we, and I've said this before, accept a level of risk tolerance and agility, and demand a level of agility that is unusual in our world.
I think that's true, and I should also mention that we have, we're not sitting idly by and waiting for F&A cuts to happen to us, right? Amy Gannon, Terry Carruthers are part of the national groups working on this. They advocate for us. They have extraordinary talent and data that allow us to be at the forefront of understanding that and advocating for what is fair. So I actually think we're going to be able to weather that storm.
Here's kind of a fun one. As a new employee and someone new to healthcare, what do our panelists believe to be the benefits and risks of artificial intelligence and its use in healthcare? Who wants to dive into that one?
I think some of the benefits are going to be how we can more effectively think about implementing safe and effective add-on complementary support to the caregivers, not replacement of caregivers, but how we can supplement the work that they need to do to be most effective and efficient in their work. Every time there's a new technology, we think that, and then we realize the reality of some of these adoptions can slowly erode joy in work. So I think we have to stay optimistic and innovative and understand it and apply it and test it, but I also want to make sure that we are not just jumping so quickly that we continue to add burden onto how we provide care, but really figure out how we enhance the safety of it and the efficiency and effectiveness of it. In the non-clinical support areas, I think this has a huge opportunity for us to think about how we design work differently. And we're going to be looking at it both kind of clinically and then non-clinically.
We're thrilled. We're really excited. We think that it can be transformative in the clinical area and the operational area, back office, front office, and it's an opportunity for us to embrace some new technology and new ways to do things, and it will force us again to look at how can we do something better, differently, and ideally have all of our clinicians back at the bedside with their patients more, spending less time doing administrative tasks, making us more efficient also on the back end so that we can, again, look to reduce the cost of healthcare and also manage productivity, be more efficient. So I think that the opportunities are great, and we just need to be very open and be willing to experiment on what does work and what doesn't work, but also be very aware. And I think our clinicians, especially our academic partners, will help us immensely in making sure that we are appropriate in using it in the clinical setting, in diagnoses and the like.
You know, I think there's some risks in the sense of biases that could develop with artificial intelligence, which could marginalize certain populations or those with different competencies. As I get a little bit older and find my iPhone even more tricky to use every day, I wonder if, I'll be marginalized in that context. Having said that, I think the biggest risk is that we don't adopt this, right? And I think that we need to look at it a little bit differently. It shouldn't be looked at as artificial intelligence. It should be looked at as augmented intelligence. What that means is that we remain at the center of this. And these are tools that help us deliver better, more complex care with higher quality to our patients. I think the problem we're going to have is that in medicine, we tend to think of things as evolving at a half log rate, like maybe doubling or tripling. And I think if you look at the speed of development of the technology, it's 1,000-fold. So even Moore's law has been dramatically exceeded. Well, when you go to thinking about doing something twice as fast, right? If I drive my car at 60 versus 30, that's one thing. Well, what if I go 1,000 times faster? Well, in that context, imagine driving a car at 30,000 miles an hour. The entire questions that we will be asking and answering will absolutely change. And not understanding that, not adopting that, not trying to keep ahead of that is probably our biggest risk. But I think the potential, as Liz said, is absolutely phenomenal.
So maybe a follow-on on that, because as an academic medical center, I think we can safely make the presumption that we're probably in better shape to use the advances in AI than certainly much of the rest of the healthcare industry in the United States. But what do you see as our competitive advantages within your own unique competitive sets? Jena?
Yeah, with AI,
Well, across the board.
technology or just all unique
Everything.
competitive set. I think it's the extraordinary talent of the people to us is an extraordinary differentiator and competitive advantage. And it is the academic mission. It is the ability to be looking for cures and innovating how care, treatment, and therapeutics and precision medicine and analytics and data and how we harness that into translating into transformative care models. You cannot do that in a community hospital setting. You cannot do that isolated in off a campus that generates this kind of brain power and this kind of quest for excellence and quest for innovation, discovery. So I think that, to me, within children's is one of our most critical, essential strategic differentiators is the power of what this campus brings. These partnerships, we can look across the lifespan together, and that's powerful, and that attracts a certain kind of talent and retains a certain kind of talent because we're not shooting for anything other than extraordinary all the time, and that'd be my differentiator.
So I would just add to that in general, when you think about an academic medical center, it's a teaching environment that encourages people to ask questions. It encourages new discovery, encourages challenging and looking at things that have not been done before. And that is exactly what we need to do with AI. So if you think about the culture and the fabric of what academic medical centers have, that already exists. So there shouldn't be the fear of asking and being challenged in those things. And that is what AI will do. So I actually think that gives us an advantage compared to some of our other organizations.
You know, Don, in the whole technological field, I have some concerns that our ability to invest may be several orders of magnitude less than money that is being invested by Facebook or Google or NVIDIA. But our competitive advantages is out there. right? I think about Rich Zane's virtual health system, right? I think of what's going on in Naresh Mandava's department. I think of people like Casey Green, who speak a completely different language than I do. Kim Muller, who is actually making partnerships with us, with those individuals. The people in this audience, that's our competitive advantage, particularly when it comes to other healthcare organizations, because I don't think they're thinking that way. And so while I think we're going to need to run very fast to keep up, our people here are going to be an extraordinary advantage for us.
Yeah, I think that's a common theme, and thank you. I think it's time for us to flip it over to some questions from our Zoom audience, and I don't know who has the mic, but if that would be Linda.
Okay, so this is for anyone who wants to answer. With science and research becoming increasingly politicized, how does an apolitical institution like CU Anschutz remain neutral without compromising on our mission?
Or I guess you could also say, do we become apolitical? I mean, I believe the answer to that is yes, but people could argue that point, and some have. With speaking for the university portion of this, and I think we all are in the same place, given the slings and arrows that are floating around in the atmosphere today, our number one goal has kind of been to stay 1 inch below the target line, and I think we've done that without compromising our values, and that's a tricky road to walk, but I think we've done it, and I think we're going to have to continue to do it. I think the worst thing we could possibly do would be to begin to take sides, in spite of the fact that many of us believe that one side probably is more aligned with our views than others. But our mission is to serve everybody, and that in that sense aligns us to be, or I think drives us toward a position where we need to stay apolitical and preach the things that we care about and the values that we believe in.
I would take a similar but maybe slightly different view. I mean, politics is sometimes an ugly word, and so apolitical, yes. But should we take sides? I think we should. I mean, I think that we should stand up for our clinicians. I think we should stand up for our patients. And I found it extremely valuable when I've been faced with political questions in this role, in this environment, because where I came from was a very different political environment than it is here. And so some of those things were really eye-opening for me. And what I've found useful is talking to the patients, talking to the clinicians who are involved in those things. And every time I've come away feeling I can be absolutely resolute in the approach going forward. So there may be some challenges, and there may be times where we have to take sides, but those sides should be on those that we care for.
And we have to be clear, we have taken sides, and we will continue to do that when our values are challenged.
Yep.
Liz or Jena, you want to comment on that? No?
We have smart women on.
Yeah. I always knew women were smarter than men. Now I've proved it. Anyway.
This question came from a faculty member. How do faculty and providers help keep our campus sustainable? What can we do additionally? How do faculty and providers help keep our campus sustainable? What can we do additionally?
Keep our campus
financially,
sustainable.
possibly,
I
sustainably.
suspect they're talking about environmentally, although I don't.
Also financially, I believe. I don't know. Maybe.
We've made a lot of ground on reducing our carbon footprint and continue to do that. There are certain aspects of running an institution or a set of institutions, and I can't speak for the hospitals, like ours, that we're energy hogs. I mean, that's not going to change. I think our facilities folks have done a great job in dealing with the art of the possible, and we'll continue to do it. It's an important an important part of the strategy of the university as a whole, and I think we need to be a big part of it.
If it's asking financially as well as what Don alluded to, I think every day we're looking at how can we be as efficient as possible? How can we ensure that we're looking at those risks that are ahead of us so that we can mitigate them as much as possible? And I think, as Dr. Sampson said before, the more that you can address them and know that challenges are coming, the better positioned that you can be. I think the other question is that what we have here is really quite unique and special, and it takes a long time to build a world-class program. So if you just take the oncology program, for example, and what has been built here, it has taken years and hundreds of millions of dollars and incredible talent and recruitment. And what everyone that's listening can do is be very clear to individuals that they speak with, be it legislators or neighbors, that there are consequences from decisions. And while we are trying to be very responsible with regard to how we spend our money, it takes very little to tear a program down. But once you tear a program down, it takes a long time to build it back if you ever can. And so I think that we're living in an environment right now where people don't necessarily recognize the consequences of their decisions. And we need to be active as people that work and live on this campus to be very clear to say, we are trying to be as responsible as possible, but the decisions that you're making with regard to funding cuts and the like will destroy things that cannot just be rebuilt in a day. And I think that that's really important when you think about the hope that clinical trials give people. If you shut down Dr. Messersmith's clinical trials, he cannot bring them back up tomorrow. And it's patients that get sick that come to us for that reason. And if they knew the consequences of what they were doing, I think that we would have a lot more engagement. And I think that's one of the things that we can do to ensure the sustainability of this campus.
Yeah, I mean, if as it relates back to what Liz said on economics, sustainability, I mean, that's probably at the fore of all of our thinking. I mean, it almost goes without saying that is we can't run any of these institutions without a focus on economic sustainability, and I think it's every decision that we make has to be viewed through that lens. Are there more?
How can coordinated research and clinical activities between Children's Hospital Colorado and University Hospital be encouraged?
Coordination of clinical activities or clinical trials?
Clinical activities.
Well, we have a number of clinical activities that we have focused on as partners and neighbors, particularly with University of Colorado Hospital. So for 12 years running now or more, we have worked very collaboratively on maternal, fetal, OB, and neonatal care, and have built one of the largest programs, not just in the Rocky Mountain region together, but nationally in some of the maternal fetal activities. So that's a big one. We are really our cancer programs collaborate very effectively together. A number of our programs do. And now I think a big conversation we're having with the child health faculty and the adult faculty at University Hospital is how to think about transition programs. So as many of the kids that are in the care of the child health faculty at Children's Hospital, as they age out of maybe what is appropriate for a children's hospital, how do we continue to collaborate to build some of those transition of care programs so that those patients experience a more seamless handoff to make sure that their care is not disrupted as they age into adulthood?
I think some of the collaboration that exists today, or a lot of it, is the reason that we're here, is the success that we have and the stability that we have as a system is because we are doing that and we do communicate well so that we don't duplicate programs, which I think leads obviously to investing together. So Colorado Springs is a great example that we live together on the campus. We built a children's hospital there. It's a great asset to the community of Colorado Springs, and we've partnered, and there's no duplication of programs, nor are there duplication of programs on this campus as well.
Yeah.
I'll only add, I think the transition of care approach is very, very important. But I actually think we do pretty well with this, right? We've got the geographic proximity, and then we've got the same faculty. So I think those things that enhance those opportunities for us.
Well, there was one very good example yesterday. We had an hour-long meeting to talk with folks from the Anschutz Foundation about the fact that we have formed a mental health collaborative that literally is from birth to late in life. Yep. And it's a continuum across the spectrum of largely clinical activities, some research and innovation, but a lot of it is looking at our clinical footprint in mental health across the lifespan. And I think it's going to be a terrific effort and has an opportunity to really, in many ways, change the mental health landscape in the state of Colorado. More, or should we switch?
One more. How is the campus working to ensure that innovations developed here in research, clinical practice, and education truly reach and benefit Colorado communities that are the most underserved, rather than reinforcing existing structural inequities in health outcomes?
You know, I can't take any responsibility for this, but the program that Myra leads in the Department of Family Medicine, and that Dr. Deutschman's led in our rural health program, and that Shanta Zimmer leads as part of our educational program, I think is an extraordinarily and even innovatively differentiating program where we train people, we embed them in the community, and we train them to be in that community, to bring what's happening at the academic center out to that community. You know, 40% of the graduates from that program remain in primary care in rural environments. Half of them remain in Colorado. So that is an innovative program. It may not sound like the typical, what we think of as innovation, right? You know, that's not AI. It's just ground roots work where you have to drive from location to location. I think by having our faculty connect with those programs and foster those individuals, it is driving the innovative work that's done here in our research and our clinical care into the communities. And I'm actually very proud of that part of our program.
I think we have one instance of EPIC across our entire platform. Our virtual health center is something we're incredibly proud about. So when you look at challenged communities like Pueblo, Parkview Medical Center that joined our system, they have access through virtual care to all of our protocols, all of our advanced care, everything from inpatient sepsis protocols to all of the ambulatory virtual health access, so that they don't have to drive far. We look at miles saved, so our virtual platform allows us to reach a lot of people on their iPhones. They can even have virtual visits. So I think that the new technology and innovation really leads itself to being able to allow patients to access our organization in every corner of the state.
And Children's, on top of leveraging the EHR that's integrated, and we have connected that to medical homes, to many primary care pediatric practices across the state. Telehealth and outreach. We are very intentional about where our providers go to spend time across not just every corner of Colorado, but from the Canadian border to the Mexico border. We are the primary responsibility to provide access to pediatric subspecialty care with our CU child health faculty across 7 states. And so very intentional about building partnerships with health systems in those communities, and making this available so you don't have to always come to Denver to access some of this world-class care.
Okay, I think it's time for us to open up the mic, which is back there, to the audience. If there are people here who would like to throw a question out, we're ready for it. This is what usually happens, stunned silence. A brave soul.
Brave soul.
Yes, well, I think we're all wondering this. I am curious about if you could just comment a little bit about the changes in the hybrid work schedule and how you see that shifting our culture here on campus, just even in the next year to the next 5 years when we're all here and in person together a little bit more.
Unfortunately, I think I'm the only one that can answer that because the hospitals are pretty much back full-time the way they were pre-pandemic. You know, we made a decision to move back to where it's appropriate, a minimum of 3 days a week on site. Some people's sites are not on this campus actually, but wherever their appropriate site is. And the reason for it, frankly, was that I felt, and the rest of leadership felt, that we had lost something in a sense of community, and that we benefit greatly by being with each other, physically with each other in a way that I don't think Zoom or Teams has any way of replicating. And I think we are moving in a direction to come back to I don't see it ever retreating fully to the 5-day-a-week model that some of us grew up in. But I think that a hybrid work model with a balance toward being in person with each other is the most intellectually stimulating atmosphere that we can have, and our whole ethos is built on our ability to be creative and to work together. So that's we have no plans to ratchet up the meter from where we hope to be in January, and I know it's posing a burden to some, but I think that we felt on balance it was the right way to go. Thank you for the question. I think. I'd like to add or end with one question for each of the panelists. You know, as we started out this, it's clear that we're going to be facing headwinds. We all know that. We don't know what they are, or to what extent they're going to impact our ability to fulfill our missions, but we know they're going to be there. On the flip side of that, what would you say in 2 or 3 examples are our biggest competitive advantages?
Our people, our partnerships, and our collaborative spirit.
That was quite succinct.
People, partnerships, and our quality outcomes.
Yeah.
Yeah, I think it's people, partnerships, and compassion.
And the only one I would add to that is nimble, because I think we, in a relative sense, compared to our peers, we have a greater emphasis on innovation and a greater emphasis on agility, and I hope that we can use and measure those advantages to our benefit for all. And the last one I would say is that we have a unique campus in that we do have a campus that covers the whole life cycle. Not many do with the level of quality across the range of the life cycle that we have. And that's something that we also need to take advantage of with 6 schools that cover the entire spectrum of healthcare education and research. So with that, if there are no other questions, we have one.
I'm Spiro Manson. I direct the Centers for American
We know who you are, Spiro. Believe me.
I arrived here in 1986. One of the things that attracted me was the general commitment and the value of diversity. And I don't mean diversity in the sense that has been the subject of such enormous debate of recently. I mean diversity in the sense of disciplines. I mean diversity in the sense of gender, age, as well as race, ethnicity. I think we can argue strongly that diversity in those senses adds value to the quality of our science, the quality of our clinical care, the quality of our education. Now, in the face of one of these headwinds that is making it very difficult for us to think and act in terms of diversifying in these positive ways our research, our clinical workforce, our educators. How do we think about in the short and intermediate term in committing to that agenda still, and ensuring that we benefit from the value that diversity in that sense brings to our work?
My answer to that was I don't see us changing one iota from our commitment to the kind of diversity that you talk about. I think that the way we approach it may have nuances, but at the end of the day, our values haven't changed. And I think our respect for the fact that we serve the entire population of the regions that we deal with makes us absolutely obligated to try to reflect that in all of the work that we do and in all the people that we have. I don't know. You want to add to that?
Yeah, we've always done the right thing. We continue to do the right thing.
I mean, I think one of the things we talk about is, to your point, patients come to see us, they trust us, and we give them the care that they need, and they're much more comfortable, and they communicate with us much better if they see people that are like them providing the care. So we have a lot of programs in place, as Don said. We've not wavered and changed anything over the past couple of years with regard to our programs. And I think everything from our Ascend program to the various hiring practices that we have, it's fundamental to our core that we make sure that the patients that come to us feel that they're represented in the care and the providers that treat them.
Yeah, I would agree. There certainly are headwinds in this area, and I think we need to meet those headwinds with a commitment to seek out what each of us can value, even if that's different between us, to commit to achieving that value and that sense of inclusiveness in all of our various missions.
I'd just come back to what we said at the beginning. We have a North Star. We know what our missions are, and those haven't changed. They're not going to change. And our job is to figure out how to execute them to the best of our ability with whatever circumstances are coming down the pike. And I think that's an exciting challenge. I hope that we can't do it without you all. You're the key to our ability to do any of this. And with your help, I think that we will prosper. So with that, thank you to all who attended here.
Thank you.
Thank you to everybody who attended on the Zoom. And please give a hand to my panelists.